Welcome back to a Wise Mind podcast presented by Sabino Recovery. Today we're going to be talking about gut health and how important it is when we talk about mental health and being just healthy overall. I'm pleased to welcome our guest today, Leanna Stetson, who is a certified holistic nutritionist. Welcome, Leanna.
Thank you. I'm happy to be here. Thank you for inviting me.
Absolutely. Yeah, I think so. We were talking about this before we started recording, but everyone knows that, a healthy diet is so important, but there's so much that goes into it beyond that, right? And
Sure.
that's where a lot of us kind of don't understand. A lot of us think that certain types of food are inherently bad and others are good. And, I think a lot of us are just lost when it comes to knowing what to put in our bodies to make us feel good. So I'm really glad we have you here today because you're going to school us on some of that stuff.
I'm interested in hearing how this all works out. It's interesting you say about that. The number one reason people go to the doctor is something to do with their stomach.
Really?
It's something like 10% of these doctor visits are really related to my gut doesn't feel good. Something's going on with my stomach. So there's really this pandemic, I think, where people are going into the doctor looking for solutions.
Yeah.
And so when we can really focus on what gut health is, I think we can find some great answers.
Yeah,
So,
well, that's what we're here to do today, is find some answers. So tell us a little bit about you and your expertise.
So, like you said, I'm a certified holistic nutritionist. I spent quite a bit of time as an allopathic dietitian for many, many years. And as I grew and learned more, functional and really integrative medicine is where my heart is, definitely. And so in about 2018, 2019, I started to notice my body was changing. And I was in pain. I was uncomfortable. I wasn't sleeping well. I had brain fog. I was like, what the heck is going on? And I really sought out a local functional medicine doctor to look for some answers. And he helped me tremendously, but part of our initial conversation was kind of funny. He started asking me about what I was eating. And he was also asking me if I ate yogurt. And I thought that was an odd question for a doctor to ask. Do you eat yogurt? And I said, well, of course I eat yogurt. Yes, I ate some this morning. And he's like, what is that all? What are you talking about? He just was really starting to talk about my gut at that point and what was my gut looking like and what was the health of it? What kind of foods was I putting down? That was like the first time a doctor really dug deep into what I was eating, and I was intrigued. And so it really led me to where I'm at now to really help others with understanding gut health because it made a big difference in my life.
Sure.
Yeah.
Yeah, and our Shara Turner, our clinical director, she's always mentioning gut health and how important it is when it comes to dealing with like mental health concerns and trauma specifically. And the gut microbiome is something that I sure don't understand, and that's kind of why we have you here. But why is the gut microbiome so important? And maybe,
What is it? Yeah.
What is it? Yeah.
Really, the gut microbiome is really a term for the collective population of bacteria, viruses, and fungi that actually live in the gut. And I'm not talking about pathogenic bacteria and viruses and fungi that cause infection or illness, but discussion or research around gut microbiome often focus on the digestive health and nutrition, right? But there's a bigger thing going on here, and this is really the vital role of that gut microbiome for overall health and well-being. And so this is often overlooked, right? And there's a lot of research that supports that if we look at the gut and we focus on healing the gut, that depression heals. A lot of these anxiety disorders start to heal as a result of healing that gut. When we're anxious and when we're stressed, our gut is listening to our thoughts all the time, and it really contributes to that. So really focusing on your gut microbiome can really impact your overall health.
Yeah, I can see that. And, everyone's looking for the answers, right? It's like, was it medication? Is it this cool new type of therapy? But it's just it's so funny how it's just so simple, right? It's like, I just need to put good things into my body.
Sure.
I need to sleep well. And, when it comes to dealing with trauma, obviously there's addressing and processing that thing we don't want to talk about that we've put under the rug. But, it's just so funny in a world where everyone's looking for that quick fix. It's like, well, this is a quick fix too. It's like, all you got to do is put some healthy stuff in your body and,
Right.
sleep schedule and deal with that stuff that happened to you. It's really not that difficult.
Well,
But
you would think so, right?
right.
Right. And in theory, we can say all those things.
It's what do they say?
Yeah.
Well, I know what they say, and I'm a recovery guy in AA. They say it's simple. It isn't easy, right? So
This dysbiosis, this idea of these imbalances in our gut are really interesting in our society. And we've really moved away from harmony with nature and harmony with the earth. And in that harmony, we've caused imbalances in our diet. It's kind of like, think of a garden, right? You have a garden and it's flourishing, but when we get things in there that aren't so nice, maybe some weeds or bugs, it can really destroy our garden. And I love that analogy and think of our microbiome as a garden that we want to fill with healthy things and things that make it flourish and start to eliminate those weeds or those insects, those things that really are destroying our garden.
Absolutely.
Yeah.
So as far as like the process goes, like how the microbiome is maybe like, I don't have a healthy gut, let's just say that, right? Hypothetically. How is my gut health related to and correlated to like my mental health?
Okay. That's a really great question. So the functions of the gut really are regulating your immune system, preventing growth of harmful microorganisms. It's also fermenting food and fiber and all those things. It's producing nutrients. It's influencing hormone and neurotransmitter production. And this is where it gets interesting. About 90% of the serotonin our body needs, serotonin is that happy chemical we all talk about, is produced in our gut, 90%.
Wow.
So if our gut is unhealthy and it's filled with things that are not contributing to this hormone and neurotransmitter production, including serotonin, we can lead to imbalances in our mental health, right? So the relationship between the gut and the brain is really well established there's lots of research regarding this gut-brain axis where it's connected. And, we learned in biology class that these things were unique, that the heart really wasn't connected to really anything. The lungs, we learned them all as distinct and isolated units. But when we really think about that, we think about, I was talking to a heart doctor, and he said, how much of what is produced in the gut really is contributing to heart health? He's like, I don't know. I thought it was going to be a really small percentage. He says, probably like 50%. I'm like, what? 50% of the microbiota in our gut is contributing to our heart health? That's a really big number when you think about we have trillions of cells in our gut, trillions of cells that are communicating with our body. And if there's bacteria in there that is good bacteria, we're going to send really great signals to our brain. If there's not so nice bacteria, those ugly bacteria that are killing off the good bacteria, then those signals are a little bit different. So that's circulating in our brain. And then we're going to add in other things. We're going to add in stress. Stress causes things like leaky gut. Anybody who has been stressed at any point in their life has had leaky gut. And what that leaky gut means is that there's food or particles or chemicals that are crossing that intestinal wall in your gut, and they're entering into your bloodstream, causing all kinds of havoc in your system, leads to like irritable bowel syndrome. So when we really understand what's going on in the gut, we can really understand what's happening in the brain at the same time, since there's this close connection and this communication that's back and forth. It's this bi-directional axis that is going on at all times.
So I think I absorbed most of that, but it kind of gave me a thought. So like, they say that like the leading cause of death in the United States is like things that are related to being overweight or obese. Is that correct?
Sure.
So like, it seems like a correlation rather than causation kind of situation where like everyone thinks that, you eat unhealthy and you get overweight and that's what leads to all your health issues. But it sounds like a lot of those health issues aren't necessarily because of the weight. That's just kind of like an added symptom. It really has to do with the health of your gut.
Sure.
Yeah.
Sure. And I think what you're getting at is how do we influence the gut microbiome, right? So food choices. What are those food choices? Really stress management or lack of stress management or unprocessed trauma, all of those things, right? And then exercise or lack of exercise or smoking, alcohol, all of these things are going to change that gut microbiome. All of those things will change it. So um, thinking about obesity being a contributing factor to a lot of disease, if we just take a step back and go, what does the gut health look like? And a good functional medicine practitioner will be able to kind of take a population census of the gut and say, what's going on down here? What kind of bacteria is living down here? Do we have an overgrowth of bacteria causing an imbalance or this dysbiosis in our gut that are causing other issues? And so a good functional medicine doctor will be able to really assess that population in a real comprehensive way. And if there's high levels of one, it might mean this. And there's certain bacteria present, like high presence of a bacteria called Akkermansia. Well, Akkermansia is great for the gut lining. Creates a nice mucus layer of the gut, which contributes to some amazing gut health when our gut has this nice mucosal lining and things aren't entering into the bloodstream, and so we're healing the gut that way. So there's so many different kinds of bacteria, and we'll get into this a little bit more when we talk about how some really great research on bacteria and binge drinking or opioid use.
Yeah. So, and I think I kind of know where this is going, because, if you have poor gut health, you're not going to get that serotonin. You're going to be depressed. You're going to be anxious, and that's going to contribute to maladaptive coping mechanisms like binge drinking or, fill in the blank, right?
Right.
And then I'm sure it's, a vicious cycle, because I'm sure you're about to tell me like things like binge drinking probably exacerbate the problem, right?
Right.
Yeah.
And it makes sense, because what we're putting in our body is creating an environment that, whatever that environment is, there's bacteria that will thrive in that environment, and there's bacteria that will not. So when we understand that certain bacteria actually will starve and die if they're not fed properly, and these are really great bacteria, and these can lead to things like glucose intolerance, which is a big area, irritable bowel syndrome. And so even just the use of certain medications, and this leads to any type of medication. So it could be something as simple as an antibiotic or an overuse of an antibiotic, or alcohol. We think of that as a chemical, right? So what's interesting about the gut and an alcohol, it changes the gut environment, and it also changes the composition of the bacteria. So 20% of the alcohol is really absorbed in our stomach, right? Followed by about 70% being absorbed in the small intestine. And then the liver comes in and it converts it to a serious toxic chemical, which damages your tissues and the gut health, right? So alcohol is a really big cause of dysbiosis. And so alcohol consumption actually can inhibit the way that your body is going to be able to detoxify it. And what's interesting is one thing alcohol does is when you drink it, it decreases the amount of digestive enzymes that you might need. And this differs from person to person, meaning it becomes more difficult for you to break down and digest nutrients, right? And when we're not breaking down nutrients or digesting food, boom, we get gas, we get bloating, we get discomfort. And a lot of people with excess alcohol consumption will report that they're having a lot of discomfort in their gut. And so it leads to bloating, gas, loose stools, all of those things can happen. And there's so much more, but alcohol makes that gut lining more permeable. And then as I was talking about earlier, is that food particles. You do not want food particles crossing that gut membrane and entering into the bloodstream, because it sees it as a foreign object or foreign chemical, and it's going to launch an attack. And that attack is inflammation. And so inflammation can be a side effect of that as well. So when we're looking at, and this is when we're talking about excess alcohol consumption, right? And then chronic, where it's going on for many, many years, can actually change the overall composition of the microbiome. Now, this is where it gets really fun and interesting, is how do you change that composition that you've created over many years of your life, right? And so to the rescue, dun, 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 here comes probiotics, right? And probiotics are an interesting introduction. They're living organisms we can introduce into our gut that can heal our gut. And the kind of bacteria we introduce is important as how often. And this is a long process. It takes 10 to 12 weeks where people really start noticing a change in how they're feeling. Some people notice right away. Some people, it takes a little bit longer, but there's probiotic supplements and then there's foods that you can consume at least once daily. I say consume a probiotic type food once daily. That's like a fermented food. Fermented vegetables, kimchi, yogurt, kefir, all of those things are fermented, and that introduces new bacteria. And all of these great bacteria start growing, and hopefully they start flourishing and getting larger colonies in the gut where they start consuming that bad bacteria, and that bad bacteria starts moving away.
So the more probiotics that I have in my gut, the healthy ones, obviously. Well, I guess all the probiotics are healthy bacteria, but they're the ones that are breaking down the food so that maybe when I eat a big meal, then I won't feel as bloated because I have all these healthy bacteria in my gut that are breaking that stuff down and helping me digest it. Am I far off?
No,
Okay.
that's about it.
Okay.
Now, does this happen quickly? No, it depends on the damage. Depends on what that population looks like inside of the gut. So if there are a lot of these bad bacteria that are flourishing, it might take a little while to heal that because they cause damage to tissue. And so the healing of the tissue could take time as well.
So I can see, obviously, how alcohol is probably one of the biggest, havoc causers when it comes to gut health as far as substances go.
Right.
What about like using drugs? And I know that there are, dozens of drugs out there, but the ones that you aren't necessarily drinking and that are going straight into your gut, can those have an effect too?
And that's an interesting thing that has happened. So let's just take a look at a study. It was done in 2020 where they took some rats and they fed them antibiotics. Okay, simple. Most of us have taken an antibiotic at some point in our life.
Right.
But what they did in this study is they fed these rats antibiotics to the point where it depleted 80% of their gut microbiome. That's a significant number. So now these rats are down to they don't have much left in their gut to really digest or process really anything. And what was interesting is that they were studying the link between what would happen in the gut and then when you introduce a drug. So what they found out, what was really interesting, is so that the rats, they gave them opioids of some kind, like a pain reliever, of some oxycodone, and they became dependent on that naturally. And then these rats that had these damaged microbiomes had more active neurons in the areas of their brain that regulate stress and pain. So they're not responding to stress and pain like we would normally. And so what they learned is that this can actually lead to fewer withdrawal symptoms, which can also lead to a higher risk of drug abuse.
Oh, okay.
Because of the biome being so damaged that the neurons are overfiring, so pain and stress aren't registering as they normally would.
Gotcha.
Yeah.
That's really interesting.
Yeah, really interesting. I mean, there's the jury's still out, and we still need more studies on this, but I just really want to point out that the gut microbiome was really critical in this. Is that, and when they introduced probiotics into the mix, the gut starts to heal, and then those other symptoms are mitigated.
Yeah, no, I just think it's so helpful, and I probably know less than most people, or did before we started this podcast, I should say. But I've heard about probiotics and how they're so healthy for you, and it's one thing to know that probiotics are healthy for you. It's another thing to know exactly why. If I can understand exactly what these things are going to do to help me, I'm going to be more likely to give them a shot and make them a bigger part of my life. So, that's why I'm really glad we're doing this, is so that we can, educate me too, but also our listeners, who a lot of them probably have the same kind of, same issues as I do with just lack of understanding. And we can take something
as simple as a lot of people take antacids, right? We have some reflux or heartburn, we take an antacid. And there's great over-the-counter ones. They offer them readily. And overuse of these antacids or overuse of any type of medication is causing imbalances. So an interesting side effect of these medications is it's decreasing the stomach acid. That's its job, right? So now we have a pH in the stomach that is super high. And the stomach's supposed to be digesting food with its normal. So now we have a pH that's super high. Now, guess what? There's certain bacteria that love that environment. They love it and they flourish in that environment. So we lead to an imbalance in a bacteria that really flourishes in an acidic environment. Side effect becomes irritable bowel syndrome. So it's like you treat your heartburn, but then you get irritable bowel syndrome, and that's a side effect of a lot of antacids. Is irritable bowel syndrome causing bloating and discomfort and gas.
Yeah, and it's the same way that people treat their maladaptive coping mechanisms as opposed to digging to the root of the issue, which is that underlying trauma. You know, that I think is a good corollary that will help some of our listeners understand. It's like, you know, we get people, and I'm one of them, who went to a few different 12-step oriented treatment centers. You know, the 12 steps were great for me, but they did not go very far to address any of my underlying trauma. And it was just a matter of time before I was back to my old habits of drinking and using drugs. Same thing with the gut, you know, if we just do, you know, taking antibiotics or the next medication that somebody tells us is going to make us feel better. It might make us feel better, right, in the short term, but until we address our gut health, it's just going to be a cycle that keeps repeating itself.
Sure. And the overuse of antibiotics have a place. It's just we want to avoid excess use of antibiotics, right? And these things, they all have their place.
Yeah.
But we want to avoid the excess use. That it becomes the solution, right?
Exactly.
We don't want it to become the solution. We want to really find out what the underlying cause of it. And a lot of it is unaddressed stress, unmitigated trauma, things that we're going to have to process. And I remember meeting with my doctor, and he would say, I can give you all the supplements. We can do herbs, we can talk about diet, and we can change what you eat. But until you process your trauma, until you process that, you might not sleep as well. You might still have issues with your gut. You might not be able to lose weight. I'm like, wow, that's a big change. So it really works together. I mean, it isn't just the probiotic.
Right.
It isn't just the diet. It's really a holistic approach of really looking at the mind and the body and the spirit, of looking at all of those things together.
So outside of, you know, doing the hard work and dealing with, you know, our traumas and also, you know, addressing the gut health, are there any other things we can do from like a lifestyle perspective that are going to help us with our gut health? Like maybe exercise? Like what else is recommended?
Absolutely. There's so many things we can do, and it's overwhelming.
Yeah.
Like, what do I do first, you know? And I get that question a lot. What did I do first? I'm like, well, do what's comfortable. If it's going to be a probiotic, let's start with that. And then add in something else that's going to be more comfortable. If it's uncomfortable or difficult, the likelihood of you continuing it is very small. So, you know, like we said, really deal with stress. Work with a therapist. Really process trauma. Process those things. And regular exercise. There was a really great study on how exercise increases your microbiota diversity, and that's important. You want a really diverse microbiome. You want lots of stuff down there, and so that's why I say when you take a probiotic, don't plan on taking the same one for the rest of your life. Change it up. Introduce new bacteria. Introduce new things into the biome, and so that's really an important part of it. You take probiotics like we talked about. Avoid smoking. Smoking has a really adverse effect on the flora, and think about the chemicals, right? Think about what's going on in the brain, because the brain is talking to the gut's talking to the brain. Sugar is a big one. Artificial sweeteners really have been linked to depression. Overuse of artificial sweeteners have been linked to depression. Avoid unnecessary antibiotics definitely is an important. But I think you have to, when you decide you want to feel better, you make a decision. I want to feel better. I want to feel better overall, and that's part of that. And that gives you your why to support what you're going to be doing next. I want to feel better, but what do I specifically? I want to have less pain. I want to be able to sleep. What is the why you're doing this? And small changes lead to bigger changes. I mean, we all know that these are big changes we want to make over time, and so a lifetime of trauma doesn't get processed in 12 weeks. We need to work on it continually, and we need to sometimes be aggressive and really take care of ourselves and find new people to make part of our team as we heal. I like to say you always should have a team of people around you, whether that's a functional medicine practitioner, a therapist of some kind. build a team around you of people that are going to support those goals as you move forward.
I love that.
I always think that I always call my group Team Leanna,
Yeah.
you know, you're going to be part of my team, you know, because I can't do it myself. I need help.
We all need a team. There's no shame in asking for help.
Absolutely. And someone's going to bring something to the conversation, even if it's just the smallest little idea. Go, oh, wow, that's a really great meditation practice. Or that's a really great way to move every day. Mm-hmm. I've never thought about that.
Yeah. And you never know what that little thing is going to be that's going to resonate with you and completely change your perspective.
Yeah, so I think start small.
Yeah.
Let it snowball. Let it become bigger and bigger until it becomes part of your life.
Yeah.
And it becomes part of, you know, take long walks.
Yeah.
Take a long walk.
Got to start somewhere. I just think it's remarkable how simple it is. And I've already touched on this, but it's just like, you know, there's always that new thing, that new shiny toy, that pill that someone says is going to fix everything. Because, you know, those people are out there and they'll try to get you, but it really just comes back to basics. And I think on the most basic level, it's, you know, what am I putting in my body? And I think you being on our podcast today, everyone knows it's good to eat healthy, but they don't necessarily know, you know, the why and the process behind, you know, why that is the best way to be. So thank you so much for being with us today.
Thank you.
And educating our listeners and me too. I really appreciate it.
Oh, you're welcome. You're welcome. Happy to be here.
And to our listeners, thank you for listening to a Wise Mind podcast presented by Sabino Recovery. To listen to more episodes, just search A Wise Mind presented by Sabino Recovery in your chosen podcast platform. We discuss topics that can be difficult to process on A Wise Mind. There is no shame in seeking help. For resources or to find someone to talk to, please visit the links in the description below.